So, this is the last official presentation of our 2 days, our main 2 days of the conference. Capacity coaching day is tomorrow. Most of you, I think, are staying for that. But this is kind of a reflection on the conference that we've had thus far. And after this, we will have a facilitated discussion about kind of what you are taking home from this after I summarize kind of my thinking on what we're taking home from this. So this was actually a really interesting exercise for me. We set the motion, like the schedule in motion for this meeting 7-8 months in advance. And so when we did that, I knew I would close the conference and kind of had this idea of like, I don't want to just present new information at the end to leave you with. I really want to summarize information that we've taken in together in this space. And I'm honored that so many people, whether they've been around or they've come up to the stage, have called us now friends. And so that in and of itself is just an amazing reflection on what this conference is about. And so thank you for bringing your whole selves here and being with the people that you're with and sharing your work, your stories. It's an amazing transformation that happens over this time. So with that, I have a lot more notes than I normally would have for a presentation, and that's because as the meeting has been going on, I've been jotting some key things down to think about. So this talk is called Progress Ahead, Progress Behind. The subtitle of Excavation, Curiosity, and Presence. And you will see why that's the subtitle for shortly. So as I was thinking about this talk, I started about a month ago really chewing on these ideas, and I asked myself some questions. The first was, what challenged us this year as a research team? And what challenges our community of people that are together here now in our coming year? And I also asked myself, okay, that and also what ties the meeting together? What are the key themes of the presentations and the discussions and workshop sessions we've had so far? So, like a good qualitative researcher, I went to patient stories. And I reflected on a few of them. The first one was, I was helping Summer as she was rehearsing through her Transform talk that she gave a couple of weeks ago. And I got to be a listening board and taken all of the amazing work that they've done over the year with Patient Voice and the Patient Revolution. And this story really stuck out to me. So she told the story of a patient who came in for knee pain. And this particular patient had a history of depression and had not been seen in clinic for a year. So it prompted a screening of her depression symptoms. So she was given a PHQ-9, and she was quite confused because she was just there for knee pain, so she didn't know why they were giving her this depression screener. And she filled it out, nevertheless. It was a 7. What the patient knew was that her score from the previous year was a 1. And what the clinician knew was that it wasn't a 10, which would have prompted action on the screener. And she also didn't indicate suicidal ideation on the screener, which would have been the other thing that would have prompted action. So the screener was left there, the knee pain was addressed, and the visit ended. But the patient was left wondering, doesn't anyone care I'm depressed? Why did they give me that screener in the first place? No one was going to ask about it. And Summer and, this was Summer speaking, but also Maggie is involved in this work, and what Summer had challenged was, what if instead this patient would have been asked, what brings you joy? And she would have said, what brings me joy is running. And since I've been not running now, this knee pain has been going on for a few months, I haven't been able to run, and I'm pretty sure that's why my depression is worse. A challenging story, for sure. And it left me with the question, are we acting in accordance with patient situations or checking the box? The next set of stories I'll share with you that I continue to mull over in the dialysis work that our team is leading is, so we did a study of patients living on dialysis, and we looked at, it's a mixed method study. So we surveyed them to understand what their illness and treatment burden were. And then we separated the groups into high versus low of illness and treatment burden. And we did in-depth interviews with them to try to we're trying to understand, the analysis is still ongoing, what is it that patients need to support them in kind of moving into that low illness and treatment burden space. So what is it that the patients with low illness and treatment burden are doing, or what are they being supported in, so that we can help design interventions for those that are in the high group. And there's 2 patient stories that just stick out to me every single time I go through this data. And I actually have patient quotes from these patients. So the patient on this side, the marathon runner, they're not actual, those are not their actual pictures, don't worry. HIPAA has not been violated in any way. But as a representation, this gentleman is the marathon runner. And he was diagnosed with end-stage renal disease very rapidly, and used it as a trigger to get healthy. And when asked about his diagnosis and what he was feeling in that moment, he said, terrified, like my world had shattered into a million pieces, but not lacking positivity. I was still alive. As long as I was still alive, there was something that could be done about it. So I just felt like taking a positive and health positive approach would work, and it worked. So this gentleman, over the time he was on dialysis, ran, even on his dialysis days. He ran like 5 miles, and then he would go to dialysis, and throughout this process, he lost like 100 pounds, and eventually got transplanted, and at the time we were interviewing, he had just completed his transplant, and him and his fiance or now wife, they were training then for a marathon together. And then there was another story in the data when asked a similar question about how she felt about the diagnosis and the treatment, and she said, okay, well, I'm going to answer this a little bit differently than you might want me to. It's not the hemodialysis as much as it is the disease. What the disease does to your body, what it does to your health, you're no longer a healthy person. I was a healthy person before I got this disease. That's such a mindset change to go from being healthy to not being healthy and never really being healthy again. So the same diagnosis in one situation, someone who used it as a place to, what he said in his own words, get healthy, and another person faced with the same situation who felt that they might never be a healthy person again. And I puzzle over this because I think about the work that we're doing to try to understand, is the story that the measure tells us the situation of the patient in high definition? One more story from one of our patients this year in a different study where we're looking at the experience of living with undercared for chronic suffering, which are conditions or symptoms that are difficult to treat, diagnose, and or image under the traditional medical paradigm. And this patient, in her interview, on her, so in this study, we're videoing these encounters, and then after the fact, we interview the patient about kind of their story leading up to the visit, and interview them about the clips of their visit as well. She says in her interview, she was being seen for chronic constipation in a gastrointestinal specialty setting. And she said, everyone's standard response is to take some Miralax or drink more water. I've done that. What do I do now? You know, I've done what everyone has told me to do. And so pretty much doctors are always like, oh, well, here is the basics. This is what I'm going to tell you. So that is why I told the doctor yesterday, don't tell me to take Miralax. Don't tell me to drink more water. And I already eat a lot of cooked carrots. I've already had 3 doctors tell me the same thing. And so this has me asking, when we listen, do we actually hear our patients? So what I will argue that these 3 stories that challenged us and continue to challenge us as researchers, there are 3 kind of themes that I think are woven through them. And that is first, that they require us to be curious. To be curious about the situation in front of us, and really what is underneath. They also require us to excavate, to dig deeper into what is at the surface. And finally, they require us to stay present. And I think what's really important about this, and I've heard this echoed in the conversations here, is we have to stay present with our patients, with our research participants, but also stay present with ourselves and our colleagues. So curiosity, excavation, and presence. These 3 themes, I think, tie together the stories that challenged us over the year and probably will continue to challenge us in the year ahead. I think they are also 3 themes that are interwoven into the sessions and the discussions that we had here today and yesterday. So I'm gonna go backwards a little bit and reflect on some of those talks and how they relate to these 3 themes. So if we go back to day 1, Ian kicked us off and he put forth the notion that we need care that makes intellectual, practical, and emotional sense. And that there isn't actually one shared decision making. There are different types of shared decision making depending on the purpose. And I invite you to think back to his story of Rachel And how that story prompted us to also think, Rachel's story, Maria Luisa's story, about centering by the person that we're caring for. In Marlene and Victor's breakout session on technical versus humanistic shared decision making, which I understand was quite a tearjerker, at least in the first day. And they talked about the need to, whether shared decision making, judging it by a transcript is enough. How do we judge that the person is leaning in or that an empathic conversation happened with the measures that we have available to us today? Francis brought about the talk on multimorbidity and a very challenging image from Twitter when we think about any of these issues, whether it's shared decision making, minimally disruptive care for patients with chronic illness. This is a challenge that we face, particularly to our curiosity. So, measures, are they doing what we actually need them to do? Is the system, the signs that it's putting up, is it helping us be curious? Is it helping us to continue to look for what is there? Yesterday, Dr. McConnell and I talked about the teamwork that is happening in Arizona. And we talked about how a single tool, while seems very simple in implementation on its surface, when we use it time and time again, actually might tell us over time what our community of patients are really needing, and give us some of the data and information about what that is that they need so that we can fully support what they need. In our panel, which we were here talking about very recently, this is like not so distant past, some of the things that they talked about was going beyond the tool and also understanding what people needed. So, for example, with the depression medication choice decision aid, recognizing that a care coordinator was needed, that there was support that needed to be guided, not just the clinician having a medication discussion with that person. And Erin, I think, gave an amazingly inspiring talk this morning about WellConnect. And in that situation, he dug deeper into data that he gleaned from a systematic review 5 years ago about what might be supportive of people's capacity. And if that was what might be supportive of people's capacity in their communities, how could we go about building that? And no different than Dr. McConnell's story or Dr. Williams' story, it took time. It took 5 years, and there's still so much work to be done. But in each of those situations, those clinicians, those researchers, those communities stuck with it and dug deeper to say, what do the people in front of me really need to have their best health? Now, this is a little graphic that Dr. McCarthy used in her talk on her workshop on the challenge of shared decision making for pediatrics. And that population is actually quite challenging. And one of the things that she said was that peds are so individualized. One 9-year-old could tell me they want all of the information, don't do anything until I know every single thing. And the other 9-year-old might say, I only want to know what I need to do today, the rest is overwhelming. And so It required her to stay present with that child to really fully understand where they were on that spectrum. And I would argue that there's actually quite a similar diversity sometimes in adults, especially in overwhelming and paralyzing situations. Natalie and JP gave us a talk on the difficulties, which I know many people grappled with the massive challenges that the US healthcare system has in terms of cost of insulin, but just cost in general as important. I pulled 2 slides from their talk that 1 in 3 Americans report difficulty paying for healthcare, and that number jumps to 1 in 2 if you're either uninsured or have a disability, and yet only 1 in 8 medical encounters have cost conversations as part of it. And so that work is requiring us to think about what are the content and the tools that can actually support those conversations in a way that is helpful to the people and also the clinicians that are trying to provide this help and have these conversations. Finally, our alcohol decision aid, little workshop that we did today. Actually, we didn't really create this decision aid. We talked about, and I quote from Marky, "Shut up and listen to the person that is in front of you." But what I really took away from that was creating a safe space that people could open up and have challenging dialogues about what was going on. That when we superimposed, we should talk about alcohol, that didn't really go so well. It was about creating the safe space that those people needed to have that conversation. These are challenges of presence. Creating safe spaces requires us to be present. Staying present with the people who are making those tough decisions. Staying present and being curious to hear that cost is an issue for the person in front of you. Curiosity, excavation, presence. 3 themes that challenged us this year, will certainly challenge us again going forward. And I would argue are 3 challenges that we have all grappled with while we have been here in this space. So I invite you to think about those 3 challenges going forward, how they apply to your work, and how we might use them to move us forward into the next year thinking about care that fits. So with that, I will say, stay tuned for Care That Fits 2020 info, because I'm sure it will have these themes resonate throughout in different ways. And I thank you for your curiosity, your willingness to dig deeper, and your presence at this meeting. Thank you. We're literally going to jump down into like a dialogue. So you can ask questions, and then also we'll have a facilitated discussion as well about just digesting all of that.
Kasey, I wanted to say I love the way you summed up everything. I've really not been at a conference where that was done so well. That was really good. You were really present for all of these sessions.
Thank you. Yes, it did. It challenged my presence in making sure that I was. I only diverted occasionally just so I could tweet your cool things.
I have 2 questions for you. One is, did it go the way you were hoping? And number 2, if it was successful next year, what would it look like to you?
That's a great question. You must be a coach or something. So I think I have learned that Every time that we host one of these, the good news is we've had them 4 years in a row, and so I don't have the anxiety about whether anybody's going to show up. Like, that's great to not have that anymore. I know that people will come and visit us and have fun. And so my hope is always that the right people are in the room at the right time, and it creates magic and collaboration. And so far, everything I can tell is that that's true. And 2020, I don't know. It's going to be our 5-year anniversary, so prepare your hearts. I am already thinking about it. I'll just leave it at that. Other questions?
How did your team make your choices in what would be addressed this year?
That's a really good question. It's a combination of factors. Part of it is what we are thinking is new and kind of on the cutting edge of this idea of care that fits. The other thing is we very much take into account participants' feedback. And so, please try to fill out your evaluations. I can read them, I analyze them, I nerd out over them. And in that nerding out, I and the team mull over what went well, what didn't work well, what do people want to see more of. So like the panel, for example, that you saw, that was something that people really thought needed to have a bigger presence. Similarly, Erin's work, people were like, we need so much more of this, please present at a bigger forum. So we tailor based on what people have said, and then we inject new content of what's on the leading edge. Thank you. Questions? Okay, now I'm going to sit down. I don't have to be in presenter mode because now you can just have a nice little conversation. So I would like to hear from you because I sort of had to summarize this in my qualitative synthesis thematic